Hello, friends, and welcome back to my YouTube channel. Have you ever heard a condition where drinking too much of water could be dangerous? That's right. Today, we will discuss about the hyponatremia, a condition that occurs when sodium level in the blood drops too low. What what exactly causes it, and why is it so dangerous? Let's find out. So, before going to the hyponatremia, we will see the what is sodium and what are the functions of the sodium and its normal value. So sodium, it helps to control and regulate the fluid volume in our body. Its concentration is the major determinant of extracellular fluid volume. It participates in the generation and transmission of nerve impulses, and it eliminated by the kidneys and small amount in the feces also. So salt intake also affects the sodium concentration. If we'll take more sodium in the diet, our sodium level goes up. Sodium is conserved by the kidneys by the reabsorption of sodium from the kidney by the hormone called aldosterone, and the normal value of sodium is the 135 to 145 milli equivalent per liter. So when does we call it hyponatremia? When our sodium level falls below 135 milli equivalent per liter, then we call it hyponatremia. So what can be the common causes for hyponatremia? Sometimes when we use some diuretics like thiazide diuretics, but sometimes it also seen with the loop and potassium sparing diuretics, but more commonly it is caused by the thiazide diuretics, and it also occur with the sodium restriction. If the patient does not take uh, patient is on sodium restricted diet, and patient is having vomiting, diarrhea, and SIADH, that is the syndrome of inappropriate antidiuretic hormone. Then it may also occur postoperatively because of the temporary alteration in the hypothalamic function. Patient will have loss of GI fluids by vomiting or suction, and hydration with non-electrolyte solution if we are continuously giving non-electrolyte solution to the patient. And postoperatively, hypernatremia also is a serious complication in the premenopausal woman, but the reason behind this is still unknown. Now we will see the pathophysiology, how this hyponatremia, what all changes it causes in our body. So sodium loss from the intravascular compartment, what will happen? Diffusion of the water into the interstitial space. So when sodium will get lost from the intravascular compartment, this water will start shifting to the interstitial space. Interstitial space is between the cells. Then sodium in the interstitial cell space, that will get diluted. Means there will be a sodium in the interstitial space, and it will decrease the osmolarity of the extracellular fluid. So extracellular fluid, when the osmolarity will decrease, what will happen is water start moving into the cells as a result of the sodium loss, and extracellular compartment there will be a depletion of water, and patient will start showing the clinical symptoms. So this is how it occurs. Then what can be the sign and symptoms patient will have? Patient will have the headache, patient will have muscle weakness, fatigue, apathy. Apathy means lack of interest, lack of enthusiasm. Then postural hypertension, when the patient will change his position, patient blood pressure will fall. Patient will have vomiting, abdominal cramps patient can have. Then weight loss. And if it is severe, then patient will have the mental confusion, delirium. Patient can go into a shock and coma. Other contributing factors that can lead to hyponatremia is excessive diaphoresis, means patient will have excessive sweating. Then wound drainage, that may be after the surgery or any severe wound patient will have. Then NPO means nil per oral, will keep the patient before the surgery and after the surgery for some hours. Then CHF, that is the cardiac heart, congestive heart failure. Then low sodium diet, renal disease if the patient will have. Then diuretics, that is increase the urine output. Now how we can manage? So before management, first step is the assessment. We have to do the head to toe assessment. So in that we will see the physical changes and sign and symptoms that are present in patient's body. So if we will see the neurological system, in that patient will have the generalized skeletal muscle weakness, headache, and personality changes we may see. As I said, one of the changes, the apathy, patient will have lack of interest. He will not take any interest in anything. He will be like a dumb. Then in respiratory system, patient will have the shallow respiration. In cardiovascular, cardiac changes maybe depend upon the fluid volume. In GI, that is the genitourinary, gastrointestinal tract, in that there will be increased GI motility. The patient will have nausea and diarrhea. And genitourinary system, patient's urine output will increase. How we can manage? What are interventions we need? So to restore sodium level to normal and prevent further decreases in sodium, drug therapy should be given. So if patient will have fluid volume deficit, so in that case we have to give the IV therapy to restore the both fluid and sodium. If it is severe, we may see 2 to 3% saline. And if the patient will have fluid volume excess, in that case we will administer osmotic diuretic called mannitol to excrete the water rather than the sodium. And we also increase the oral sodium intake and restrict the oral fluid intake. So this is how we will manage the hyponatremia in the patient. So this hyponatremia is a serious and preventable condition. By staying mindful of your hydration level and monitoring your sodium intake and seeking medical advice when needed, you can keep your body in balance. So if you found this video helpful, don't forget to give it a thumbs up, share it with your friends, and subscribe to channel for more health related content. Want to learn about more electrolyte imbalances? Check out our next video on hydration and how it affects your body. So next video will be regarding hypernatremia. Thanks for watching. Stay healthy and I will see you in the next video. Thank you so much.